Good evening.
Happy Tuesday, everyone. It's Bob and Whitney Marema here.
Welcome back to another episode of
Everything you need to know about vitamins.
How about that?
So, every week we're just going to do a hot topic, just a quick one, nothing to take up too much of your time, but just something that's relevant to you, and then allow any opportunities for questions. I see the comments are open, so if anyone logs on and has any questions, please feel free to type them in the chat box.
I do have to share one funny thing that happened today in the office.
Mm-hmm.
So, I was talking to a patient, longtime patient, 20 years, and she was talking about bringing the document that the American Society of Metabolic and Bariatric Surgery produces regarding vitamin testing and what blood work to get and, et cetera. And she brought it to her primary care physician and said, I thought this might be a benefit because I'm kind of unique. I've had surgery and so this is, all about the vitamin testing I should have and interpretation and whatnot. And the doctor apparently said to the patient, well, I've been to medical school.
Ah.
And so she reached for the document to take it back again, and the doctor said, no, I'll hang on to it.
Oh.
So the reality is an awful lot of physicians are hungry for the information but embarrassed that they need it because they're supposed to know everything. And in actuality, physicians don't know everything about everything. They just can't.
Yeah.
And so it is important to have this knowledge. And so let's bring it forth.
Yeah, and I don't think that there's anything wrong with us as patients advocating for ourselves. I mean, it is what it is. Not everybody is going to know the uniqueness and the intricacies of a bariatric patient. It's just not reasonable to consider.
True.
So, to that regard, I think it's important to advocate for yourself. And so what I see so often is I see people who go to their doctor or they post messages on these groups saying, I get my labs checked and they're fine. I take a Flintstone and all my levels are perfect. I don't take vitamins at all and all my levels are perfect. And I think there's just a couple of dangerous things to consider in that mindset. Number one is that their labs are fine yet, right? So far, because many of the most significant and serious vitamin deficiencies take years and years to develop. So we can't just stick our heads in the sand and say, well, my labs were fine. The other thing to consider is that we are not normal. And I think let's be real for a second and let's just acknowledge the fact that we had our complete digestive system reworked in a way that causes us to maldigest and malabsorb nutrients. So when you really think about it that way, is it reasonable for us to consider a wait and see approach? I say not, but I've also been doing this 25 years and I've seen people have severe devastating consequences as a result of not taking their vitamins or getting their levels checked.
And let me just make a couple of examples of these severe and devastating consequences. I have seen a 40-year-old woman have a heart attack because she got so anemic for not taking iron that her blood count was so low she had a heart attack. I have seen a 30-some-year-old woman locked in a wheelchair for the rest of her life because she didn't take vitamins. She became malnourished and vitamin deficient in some critical vitamins that affect your neurologic system. So these are just two quick examples, extreme examples, of course, but these things are happening out there and we want to help protect people from that.
Yeah, because it's our duty. I mean, we do this operation and we counsel people and we have a platform to be able to do it. So we want to pass along the best information that we have. And so for me, what I do in my clinic in Florida, in St. Augustine, Florida, is I see all the post-op patients. I run 14 vials of blood on all of my post-ops.
That's too many.
How many it takes to follow the guidelines that our surgical society has said are necessary. So I'll tell you a couple of the highlights, and this video will be posted in the group so you can come back and jot them down later. But for sure, we need a full iron panel. So that's not just your CBC, right, with your hemoglobin and hematocrit. We need an iron panel that includes total iron, percent saturation, and ferritin, because it's this whole picture. It's like your savings account, your checking account, and like maybe some of your mutual funds all put together. Like it's the total health of your iron.
I love that analogy because it really helps people understand that you have some in reserve for emergencies, but you have the stuff you're using every day. That's your checking account. The savings are your reserve emergencies. And then you're investing in the future, your mutual funds, so to speak, and that's your deep source of storage.
Right. So a full iron panel is definitely needed. Um, Vitamin B12 and folate are definitely recommended, and I do always run those. However, in my opinion, there's something a little bit more important than those two levels, and that's a level called homocysteine. Homocysteine is a level that is a functional marker of how much B12 and folate we're actually getting into our cells. And
Where is those things used? Oh, wait, they're used inside the cell.
right, so we have to get B12 into our blood, but then we have to get them into the cells. And there's a conversion process that our bodies and our cells have to do in order to make that happen. And there's a pretty good amount of people who don't have a kick butt conversion system, and so they suffer in getting B12 into the cells. So
but their serum level's perfect, so it looks like they're fine.
It looks like they're fine, but they're still walking around with numbness and tingling in their hands, and things that are symptoms of fatigue and low energy, brain fog, symptoms of B12 deficiency. So homocysteine is very important. I see a lot of deficiencies in vitamins, fat soluble vitamins, especially in our gastric bypass people. Vitamins A is very common, vitamin K, and all across all patients. Vitamin D deficiency is super, super common. And, I won't spend a whole lot of time getting into like all of the different symptoms of the deficiencies because we could go on all night, but just think about a couple of things for a second. The vitamin A deficiency causes trouble seeing at night. If any of you are walking around with poor nighttime vision, maybe get a vitamin A level checked and take a vitamin A supplement if need be. Vitamin D is responsible for muscle aches and pains. It is associated with our immune system. It's also got a lot to do with how well we sleep. So, we have these building blocks, and I know it's the name of our company from purposefully, but these building blocks that literally run all of the functions in our bodies. And so we want to not just take the right kind, because we need unique forms of some of these supplements. Because like for a bariatric patient, one iron is not the same as another iron, is not the same as another iron.
Absolutely.
But we also need to test them. Our bodies change, our needs change, our diets change as time goes on.
Our ability to digest and absorb changes over time, with or without surgery. Even as you age without having a bariatric operation, your ability to digest and absorb the nutrients and the vitamins changes significantly. Okay.
Yeah, no, I feel like, I'm a fairly young person, and yet when I do my labs regularly, I'll treat one problem, and the next year that I go do them, I have something slightly different. And so while still living a healthy lifestyle and taking good quality, very high quality supplements. So I think it's reasonable to expect that this is just something that if we are going to be health seekers and we are going to look after not just our weight, but our health. Oh, and one more thing about weight management. Not having adequate vitamins on board and having vitamin deficiencies will cause you weight gain. Simply because
100%.
You're too tired, you're eating your way through just trying to get some energy, and
your body is seeking foods that might have what you're deficient in, and so you end up grabbing way too much of a variety of things just so that your body is hopefully going to be satisfied for its needs.
Yeah, not just for a little snack, not for hunger.
Right.
All right, y'all. Well, it's 7:30. We've got to hop off. We look forward to seeing you next week. If there are any topics you'd like to see covered in our Tuesday topics, please share it in the comments. I will either check the group or have Hannah get them to me so that we can make sure that we get all of your kind of comments and burning questions answered. And if there's anything tonight you want to post in the chat, we have a minute left.
We do? We have a minute left. Okay.
I mean, we're going to make a minute.
We're going to make a minute?
We're just going to make it.
Okay.
I don't see anybody hot to chat, though, so we're going to call it. Have
All
a
right.
great rest of your week, everybody.
Take care. See you next week.